non-surgical facelift. So if you have not watched my previous video on surgical facelift, please watch them. But in this video, let's look at what are the non-surgical options that we have to actually give a result similar to facelift. Now, with aging, there are 4 components that you need to address. For example, you have to address the skin, you have to address the effect of animation that happens over time, like the wrinkles that forms on animation, and the third is the volume loss that happens, and the fourth is the descent of tissue that happens with aging. So these are 4 things that happens with aging. That is, the skin loses its elasticity, there is breakdown of elastin and collagen, and so skin expands. That is one. And of course, a skin loses its luster, the skin texture changes, hyperpigmentation, which is a very common problem in the skin of color. So these are changes that happens in the skin. Next is the effects of animation. So there's superficial, medium or deep wrinkle and static folds happening in between your brows, and of course you will see a prominent nasolabial fold, marionette lines, all these folds happening. Of course, folds on your neck, all of this happening. The third is volume loss. Because you lose volume in certain areas, this contributes to the descent or actual volume loss. Some feel that the cheek has sunken in, and or some will feel that because the volume descent, they feel more volume in some areas, so there's hollowing in some areas, so volume loss. And the fourth is people look at jowling, so your jawline is not defined because the descent of the tissues from the face. And of course, the medial descent of the tissue will cause nasolabial fold and fold along your mouth. Now, non-surgically, when you want to address, one procedure cannot address all of them. This is very, very important for you to understand. So there are multiple procedures that you might need to undergo to get a result somewhere mimicking the results of a surgical facelift. It will definitely not give you a result equivalent and also lasting like the surgical facelift. But definitely, when you start these procedures a little early, you can postpone or you can get away without a surgical facelift, and these need to be repeated on a timely basis, and because their effects last for a certain number of time. Now, there are multiple options to address each of these components that I've spoken about. Like, let's say for the skin, if there is a laxity of the skin, we want to tighten the skin. To tighten the skin, the basic requirement is collagen remodulation. So if you want collagen remodulation, you can use energy-based devices, you can use injectables. So when I say energy-based devices, you can use laser, you can use radio frequency, sometimes ultrasound as well. So these are used for collagen remodulation. Then next comes is to reduce animation effect. So to reduce animation effect, of course, the best is neuromodulators or the injection. The common brand that you would have heard about is the Botox. So if there is certain wrinkles that's happening when you smile, like the crow's feet or the forehead lines, certain things that comes with because of the animation effect or the pull of the strips of muscle that are attached from the underlying facial muscles to your skin. Now, giving neuromodulators to reduce this pull actually gives you a sort of a lift and reduce these wrinkles. So neuromodulators. Then actual volume loss. If there is actual volume loss, you may need to replace them with volume. That's when you use what is called the filler. The material that are normally present in our soft tissues, hyaluronic acid is replaced back to restore volume. And the last one is to reposition the tissues that have descended back to their position where they were originally present. So elevation. So this again can be done with threads and of course devices. So some people also experience, when we talk about volume, it's not just volume lost, it can also be volume gain. So if there is volume gain, a bulky face, then of course to reduce volume, we can also use high intensity focus ultrasound as well as you can use radio frequency. And so you have all of these armamentarium to give a non-surgical facelift. So again, when it comes to skin, you have injectables, you have lasers, you have radio frequency, fractional radio frequency, which you can to use to resurface the skin, to tighten, collagen remodulation, all of this. The next is animation. You have neuromodulators that are used to reduce animation. And when you have bands in your neck, we use some body wires to remove those bands as well. Third is volume replacement and volume reduction. For volume replacement, you need filler material non-surgically, and for volume reduction, you can use high intensity focus ultrasound. And there are also some procedures like endolift, where endo laser can actually contribute a little to each of these steps. Endo laser can help in facial rejuvenation, it helps to reduce fat, it helps in collagen remodulation, and it also can reduce some wrinkles, animation effect. So endo laser or endo lift can help you in multiple of these steps. Then last comes repositioning the tissues back into their place, and for that we use threads. So if you are looking at a non-surgical option of facelift, so you've been considering surgical facelift but you're scared about anesthesia, scar, then you want to consider non-surgical facelift. One single procedure is not going to give you the result, right? Each of them can contribute 10-15%, and the cumulatively you may achieve around 50 to 60% of what a surgical facelift can contribute. So if you actually are considering facelift, consult a surgeon who actually can offer you both, so that they will discuss both the benefit of a surgical facelift and the risks of surgical facelift, so you understand that, and as well who's well versed in treating all these non-surgical procedures, so you can choose what best suits you based on your lifestyle, the downtime you can take, and of course your expectation. So if you have not watched the surgical facelift video, please do watch the previous video as well.